I'm Crystal Wyatt. I am the Community Research Coordinator for Drexel University, Dornsife School of Public Health. I also am a native Philadelphian, and I own and operate a transportation service to the prisons where I take loved ones to visit someone who's incarcerated. I came to recognize trauma as an issue early on in my career. I was working with Drexel University as a community mobilization team member for a violence prevention project. And the project had us in Southwest Philadelphia doing community capacity building around violence prevention tips. And we were working with the Community Advisory Board and a Youth Advisory Board. And one of the things that we did not realize was that trauma was the underlying current of every interaction that we had. And through that, we realized that we wanted to do a little bit more work in the Southwest Philadelphia community, because some of the Community Advisory Board members stressed the importance of feeling kind of burnt out, having a bit of compassion fatigue, dealing with a lot of toxic stress. Of course, they weren't using those terms. They were just like, we're tired, it's a lot going on, we're exhausted. So I was introduced to trauma work through the Violence Prevention Project, but also through my transportation service dealing with women who are going up to prisons, and just hearing the stories that they're sharing on the van about police, coming to their homes, or just the idea of going to court with a loved one, or being the sole provider of a family where the mate is left, who's incarcerated, and they're left to man everything. But again, these two populations weren't using the word trauma, but I knew that something wasn't right, and I didn't quite have the language around it. So we had an opportunity after working with the Violence Prevention Project to participate in Community-Driven Research Day. Now, Community-Driven Research Day it gives an opportunity for community-based organizations to come share their ideas with the academic community, and an academic partner will partner up, write a grant, partner up with the CBO, and explore that research question, whatever it is. So we had an opportunity, my colleague, Dr. Nicole Vaughn, to partner with City Lights, which is in Southwest Philadelphia. And their question was how to build resilience in community leaders. So while we were working on this idea, we did get the grant. It was a small grant, but we had the idea that we wanted to use the sanctuary model. Now, this was interesting because we had, all three of us, the directors, Kerry Davis from City Lights, Dr. Nicole Vaughn, and myself, had not read Creating Sanctuary. So part of our design was to read Creating Sanctuary so that we could build survey questions, focus group questions, to take it back to these community leaders. It was about 13 of them, and figure out a way to create a trauma-informed plan. So in reading Creating Sanctuary, I realized that the word trauma is heavily used, and it's a real thing, and that trauma theory is not necessarily what's wrong with you, but what's happened to you. And I think that's when I had my aha moment about the violence prevention work we were doing, the work I was doing with the ladies on the van, is that it's not what's wrong with people, it's what happened to them. And so I started to change my thinking and my framework, and just developed a passion for wanting to do trauma-informed work in the city. But the tricky part about reading Creating Sanctuary is that she mentioned, Dr. Sandy Bloom mentioned the ACEs test. And so, this is anecdotal, but right before a meeting, I said, well, what is this ACEs test? Let me go online, because I wasn't familiar with it. I went online, printed it out, took the test, and was shocked at my own ACEs score, and had a meeting like in 5 minutes. So when I go into the meeting with Kerry Davis and Dr. Vaughn, it took them about 30 minutes to talk me off the ledge. So I know that, once you do an ACEs study or the survey, and you get those results, you have to have some systems in place immediately for some therapy, care, something. But we got through it, and we were able to create our focus group questions. We were able to create our survey questions, and we went into the community. The community project had about 2 focus groups, the survey, and then we were going to develop the plan. But the great thing about this was that Dr. Sandy Bloom came to our community group and gave a 2-hour dose of sanctuary, the sanctuary model. Now, the sanctuary model, in the traditional sanctuary model, is a 5-day training out in Yonkers, New York. So we were privileged, I think, to have just a dose of it, so a 2-hour dose. And she focused on the safety plan, self, and self-care. So we did a lot of, talking during the focus groups, and we found that these community leaders were dealing with vicarious trauma. Some of these community leaders worked in daycare systems. They worked at the CDC, community development corporations. They worked in schools in the neighborhood. They were pastors in the neighborhood, and they had all experienced some type or form of vicarious trauma. And although they weren't calling it that, they were really, really resilient. We realized that through the surveys, through the focus groups, that they exhibited low burnout, low compassion fatigue, and they were really, as I said, resilient. But when it came to self-care and safety plans, we realized that the community just didn't have those systems in place. They were just going, and not being able to take care of yourself is one of the things that I think is paramount in the community. There's one story that came to mind when working with the community leaders in Southwest Philadelphia. There was a pastor who she's a staple in the community. She's been there for about 30 years, has a food pantry at her church, and she was actually going through an active crisis at that moment. Now, she was still at the meeting, still present during the focus group, but at that time, she had a friend who was calling her and texting her about taking a visit up to the prison to visit her son, who had just been stabbed multiple times. And this pastor, what I appreciated about us now having this language and this information about trauma-informed care, we took the time to let her process that, because there was no way, one, that she was going to be present during this focus group, or two, she needed more tools to be able to assist her friend. And one of the things that just struck me was that it was hard for her to acknowledge that this was a traumatic experience. Some of the women that I work with in my transportation service, they don't see the pain that they've experienced, the grief that they've experienced, the physical trauma. It's like they don't see it as trauma. And I think what happened in that moment was for me being able to wrap the language around what was happening to her in that experience and giving her those tools so that she could support her friend. So some of the changes that we've helped facilitate through our City Lights work was bringing awareness of the sanctuary model to the communities. And since then, of course, as an academic researcher, sometimes we pull out of communities, and the communities are left to carry on the work. So City Lights has created multiple workshops around the sanctuary model. They have partnered with, it's a foster care organization in Southwest Philadelphia called The Village, who are all sanctuary trained in the sanctuary model. And so they have facilitators who come out and do trainings in the community. One training we were able to not participate in but observe was at Mitchell Elementary in Southwest Philadelphia, which is my elementary school, because one of the teachers she had the buy-in. She was actually was the principal who bought into the the good idea that trauma-informed care is important, not just for children, but for teachers. And so she brought that training to her teachers, and we were able to sit there and observe. And I have one friend who's a teacher at the school now, and so it happened during a day where they were having like a all-staff teacher meeting, and the school was closed. And so the teachers had been there all day, so they were just like fried. And my one friend, she was about to leave. She's like, I got to finish a paper for my class. And I was like, you can't leave. You can't leave. You're about to, experience something amazing. And she was like, okay, Crystal, I'll stay. So she stayed, and it was only an hour, and it was about psychoeducation and what happens to the brain. And at the end of it, she was just like, I'm so grateful that I stayed here. I think the other thing that came out of that was that teachers were able to say, okay, so the little boy in my kindergarten class, it's not what's wrong with him, it's what's happened to him. And a lot of these kids, they have a lot of stress before they come to school. So these teachers were able to say, wait a minute, I need to take better care of myself so that I can handle this 5-year-old kid who has these other issues. So I don't know if that's the answer to the question. Okay. And then in my work for my transportation service, I'm able to, I wish I could give sanctuary to all the ladies who travel on my van, and I can't do that. But what I do try to implement on the van while I'm driving is the importance of self-care, in giving them the information that trauma has happened, when they're sharing the case of their loved one, or they're sharing the crime itself, what happened, and I always say to them, that had to be traumatic. And they're like, yeah, it was, but, and I was like, no, there's no buts. Just take a moment, to recognize that this was a traumatic experience. And if you don't feel okay, that's okay. So I learned a lot. I'm learning a lot, and I would love to do more implementing that in my business, but I'm glad that I can do what I do in Southwest Philadelphia, which is where I'm from. I think what we really need to do in order to have a trauma-informed city is to acknowledge the fact that we've been traumatized. And I don't think that happens enough. I don't think it happens enough with our politicians. I don't think it happens enough with our healthcare providers, that something really bad happened in Philadelphia about 20 years ago, 25 years ago, and we don't talk about it. And it was a drug epidemic that swept through our city, and it decimated our families. It destroyed our systems, meaning our school systems, the infrastructure of our community was just ravaged by this. And it's almost like putting a Band-Aid on a gunshot wound. If you don't acknowledge that this trauma happened, we're never going to heal. And so acknowledging that the trauma happened, acknowledging that the epidemic came through, once we do that and then start apologizing to folks, for the mass incarceration, the breakdown in the school system, once we start saying, we have to take responsibility for this. This is all of our faults. Once we do that, then we can start introducing the language of trauma, right? So first acknowledging that something bad happened here, and then saying, this was traumatic, and this is the theory. It's not what's wrong, it's what happened. It's in 10 to 15 years, if we've acknowledged what happened and have been able to include trauma theory, trauma work in our communities, I think that every community in Philadelphia would have, what is my little passion, a sanctuary hotspot, right? So that people who are experiencing trauma on any level, whether it's workplace trauma or trauma in the home, or just relationships, that they have a space that they can go to get the tools that they need to be productive citizens. So it's like, it could be a storefront, but it's like a sanctuary storefront where folks can go and get the tools, get the information, and then check back in. And then all these and that this sanctuary hotspot is linked to the healthcare system, in particular the mental health care system, and the school system, and I'm not going to talk about housing because that's not my thing, but just all those different systems, as long as they're all linked in and this sanctuary hotspot is like the hub to house that, then I think we're onto something good. I think Philadelphia is headed in a great direction in terms of beautification, but I always say it's a beautifully ugly city. There's some really bad things that happen here, but it's beautiful. And if you want to be authentic and true to the beauty of it, then help people. Give them what they need. Put these hot spots in communities like Southwest Philadelphia and Strawberry Mansion and Kensington. Put them there so that folks know that they have somewhere to go when it gets too heavy. What I want to say is that I think it's important, if Philadelphia is going to be a trauma-informed city, that the buy-in has to happen throughout the entire city. So currently I'm at an academic institution, and I think it's important that if we are, I'm at an academic institution in public health, and trauma is definitely a public health issue, and I think we need to have the buy-in from the larger university in order to make sure that the community that this anchor institution sits in is trauma-informed, and has the plans and systems in place so that it can thrive and be healthy. And I think that's the commitment that universities need to make, universities and hospitals that are in communities that have high violence, low employment, even obesity, diabetes, health disparities. They need to be able to support the people in the community in order for everyone to be healthy. That's what I think. One of the things that I think is extremely important for institutions that are in communities that have high health disparities and high violence and trauma is the importance that these are communities and they're not just data, right? And so it seems as though most of these institutions, hospitals, universities, they look at the community as a way to get data, a way to have students go in and do community research. But if you're not training, if you're not respecting the community as people and not just data, then I think you're doing a disservice to not only you as the institution, but to the community at large. I think it's great to have an opportunity for students to get community-based knowledge, to do the research, but you have to remember that the community is the expert. They know what's wrong with them. They may not have the language around it, and that's where the institution comes in and supports that, which was kind of what happened with CDRD, Community Driven Research Day. But I think it's very, very important in order for us to work collectively and collaboratively on the trauma issue, is that everyone is seen as an equal, equitable partner to be able to have this dialogue and to support one another in the healing. We see it a lot, it's data, but how do you go in there? There's recruitment strategies that you need to use. There's just all kinds of ethical things that need to happen when you're working with a community that's been traumatized. And communities do not trust higher ed. They do not trust the institutions that are anchored in their community. They've been, for lack of a better word, raped over, and they're tired, but we still want them to heal. 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 Want them to heal.